When anxiety hits your chest, it can feel like something is seriously wrong. Your mind races, your breathing gets weird, and every heartbeat feels loud. The goal is to calm fast, without talking yourself out of getting help if it's actually a medical problem. So here's the simple plan. First, screen for red flags. Second, reduce the body alarm. Third, decide your next step with a clear head. Chest anxiety is often your nervous system in high alert, not a sign of danger, but often is not always, and that distinction matters. In the next few minutes, you'll learn quick checks that keep you safe, and calming tools that work even when you feel panicky. You don't need perfect calm. You need enough calm to think, and you can build that in under 2 minutes with the right sequence. Let's start with the safety filter that prevents both overreaction and underreaction. Moving to slide 2. Before you assume it's just anxiety, do a quick red flag scan. Seek urgent medical help if chest pressure is crushing, heavy, or spreading to your arm, jaw, back, or shoulder. Also take it seriously if you have shortness of breath at rest, fainting, new confusion, or you're drenched in cold sweat. A fast or irregular heartbeat can happen with anxiety, but if it's new, extreme, or paired with dizziness, treat it as a reason to get checked. Same if you have known heart or lung disease, recent surgery, blood clots, or you're pregnant or postpartum. Another red flag is chest pain that's clearly triggered by physical exertion and improves with rest. And if this is your first ever episode of intense chest symptoms, it's reasonable to get medical evaluation. The point is not to scare you. It's to give you permission to act quickly when the pattern doesn't fit your usual anxiety. If any of these match, prioritize safety over self-soothing. Moving to slide 3. If no red flags are present, shift to the fastest way to calm chest anxiety. Change the breathing pattern. Chest anxiety often comes with overbreathing, sometimes called hyperventilation. You may not feel like you're breathing a lot, but you're breathing a little too fast or too high in the chest. That can drop carbon dioxide and create tightness, tingling, and a pounding heart. The fix is not huge breaths. It's smaller, slower breaths with a longer exhale. Try this. Inhale gently through your nose for 4 seconds. Exhale through pursed lips for 6 seconds, like cooling soup. Do 5 rounds. Keep the inhale quiet and low, and let the exhale do the work. If 4-6 is too much, do 3-5. You're training your nervous system that the emergency is over. Within a minute or two, many people notice the chest loosening and the heart settling. Not perfect, just less intense. Moving to slide 4. Next, give your body a clear downshift signal using muscle release. When anxiety spikes, chest, shoulders, and jaw tense up. That tension itself can feel like pressure, which then scares you, which adds more tension. Break the loop with a quick sequence. First, drop your shoulders on an exhale. Second, unclench your jaw and place your tongue lightly on the roof of your mouth. Third, open your hands and let your fingers rest straight, not curled. Now do one deliberate tension release. Squeeze your fists and tighten your shoulders for 5 seconds, then release fully for 10 seconds. Repeat once. This works because your brain reads muscle release as safety. It's also practical. If your chest discomfort reduces when you release tension, that's a clue anxiety is playing a big role. If it doesn't change at all, that doesn't prove danger, but it's useful information. You're gathering data while calming at the same time. Moving to slide 5. Now ground your attention because chest anxiety feeds on scanning. You check your pulse, you monitor every breath, and your brain treats that monitoring as proof something is wrong. Use a grounding drill that's fast and not cheesy. Pick 3 neutral objects around you and name them in detail: color, shape, texture. Then name 3 sounds, even quiet ones. Then name 3 physical sensations that are not your chest: feet on the floor, fabric on your skin, air on your hands. This shifts activity away from threat detection and back to normal sensory processing. If your mind snaps back to your chest, that's fine. Just redirect again without arguing with yourself. You're not trying to think positive. You're trying to stop feeding the alarm system with constant checking. Do this for 60 seconds while keeping the longer exhale breathing. Many people feel the wave peak and start to drop when they stop monitoring for catastrophe. Moving to slide 6. A big reason chest anxiety stays intense is catastrophic interpretation. The sensation is real, but the story your brain tells about it is optional. Use a simple reframe that doesn't dismiss risk. This is a body alarm. I'm checking safety, then I'm letting it pass. Notice how that sentence includes both parts, safety and calming. Another helpful line is, uncomfortable is not the same as dangerous. If you've had panic before, remind yourself of the pattern. It rises, peaks, and falls. You can also label the sensations like a scientist: tight, warm, pounding, fluttery. Labeling reduces emotional intensity in many people because it engages more analytical brain networks. Avoid wrestling with the question, what if it's something serious? Instead, answer it with a plan. If red flags appear, I'll seek help. For now, I'm doing the reset. Plans calm the brain more than reassurance does. Moving to slide 7. Let's talk about the chest sensations themselves, because mystery increases fear. Anxiety can cause chest tightness from muscle tension between ribs, shallow breathing, and a braced diaphragm. It can also cause sharp, shifting pains that come and go, especially with posture changes. Heart pounding is common because adrenaline increases heart rate and force. You might notice skipped beats or flutters, often benign extra beats that feel dramatic when you're hyper-aware. Reflex can also mimic anxiety chest pressure, and anxiety can worsen reflex, which becomes a loop. None of this is a diagnosis, but it explains why the sensations can feel intense, even when you're not in danger. A useful clue is variability. Anxiety symptoms often change with attention, breathing, and posture. Dangerous problems can also vary, so again, this is a clue, not a rule. The goal is to reduce uncertainty enough that you can respond wisely instead of reactively. Moving to slide 8. If your chest anxiety is still high, use temperature and pressure signals to calm the vagus nerve pathways. One quick method is cold on the face. Splash cool water on your cheeks and around your eyes, or hold a cool pack there for 15 to 30 seconds. Then breathe out slowly. This can trigger a mild dive reflex that slows the heart rate in many people. Another option is firm pressure. Place a hand on the center of your chest and one on your belly, and press gently while you exhale longer. Or wrap yourself in a blanket for steady pressure if that feels comforting. These are not magic tricks. They're body cues that shift you from fight or flight toward rest and digest. If cold makes you feel worse, skip it. If pressure feels claustrophobic, skip it. You're looking for a noticeable downshift, even a small one. Then you return to the breathing pattern and grounding. Moving to slide 9. Now make a clear decision. Do you monitor at home, call a clinician, or seek urgent care? Here's a simple decision ladder. If any red flags show up, or your symptoms are new and severe, choose urgent evaluation. If there are no red flags but the episode is unusual for you, lasts a long time, or keeps returning, consider calling a healthcare professional for guidance. If it matches your typical anxiety pattern and reduces with the reset tools, home monitoring is reasonable. When you monitor, set a timer for 10 to 15 minutes. During that time, do the breathing and grounding, and avoid repeated pulse checking. At the end, rate intensity from 1 to 10. If it's trending down, keep going. If it's not changing or it's escalating, move up the ladder. This approach prevents two common mistakes: ignoring something important and spiraling into endless self-checking. You're using structure instead of fear to guide you. Moving to slide 10. A few habits make chest anxiety worse in the moment, even though they feel logical. The first is repeated pulse checking. It keeps your brain locked on threat. The second is huge deep breaths. That can increase lightheadedness and tingling, which you then interpret as danger. The third is immediately Googling symptoms because it spikes uncertainty and adrenaline. Another trap is bracing your chest and holding your breath to test pain. That tightens muscles and can create more discomfort. And finally, trying to force the feeling to stop. Anxiety often drops faster when you stop fighting it and start guiding it. A better approach is one safety scan, one calming sequence, one decision point. If you want a phrase to remember, use check, slow, shift. Check for red flags, slow the exhale, shift attention outward. Simple, repeatable, and it keeps you from doing the things that accidentally pour fuel on the fire. Moving to slide 11. Once the wave passes, do a short debrief so you learn from it instead of fearing the next one. Keep it simple. Ask, what was the trigger? Stress, conflict, caffeine, poor sleep, dehydration, intense exercise, or reflux? Then ask, which tool worked fastest? Longer exhale, muscle release, grounding, cold, or pressure? Write one sentence you can reuse next time, like, my chest feels tight when I overbreathe, and slow exhales help. Over time, this builds confidence, which reduces the intensity of future episodes. If chest anxiety happens often, consider longer-term supports like therapy approaches that target panic, gradual exposure to body sensations, and stress management routines. Studies show skills-based approaches can reduce panic frequency and fear of symptoms. Also consider a medical checkup if you haven't had one, because ruling out medical causes can reduce uncertainty. The goal is not to eliminate anxiety. It's to stop being hijacked by it. Moving to slide 12. Let's put it all together into a 2-minute protocol you can memorize. Step 1. Pause and do the red flag scan, spreading pressure, fainting, severe breathlessness, cold sweat, major risk factors. If yes, seek urgent help. Step 2. 5 rounds of gentle nasal inhale and longer pursed lip exhale. Step 3. Drop shoulders, unclench jaw, open hands, and do 1 tension release cycle. Step 4. Grounding. 3 objects, 3 sounds, 3 sensations away from the chest. Step 5. Choose your next step using the decision ladder and a 10-minute timer. That's it. You're not trying to win an argument with your brain. You're running a protocol. If you want a quick reminder, save these 3 words. Screen, slow, decide. Screen for red flags. Slow the exhale. Decide with structure. That sequence keeps you safe and helps your nervous system settle without denial or drama. Moving to slide 13. If you want to make this easier, practice when you're calm. That sounds backwards, but it's how your brain learns. Do the long exhale breathing for 1 minute a day so it feels familiar under stress. Practice relaxing your jaw and shoulders while walking or sitting, because those muscles often lead the chest tension. And rehearse the decision ladder once, so you don't have to invent it while scared. One more important point. Chest anxiety can coexist with real medical issues. So if you're ever unsure, it's okay to get checked. Getting evaluated is not failing at coping. It's using good judgment. If this helped, tap the button to subscribe for more practical mental health skills you can actually use. And I'm curious, when chest anxiety hits, which helps you more? Breathing resets or grounding? Comment A for breathing, B for grounding. This information is not a substitute for